So 2015 was one of our first samples, and it was small, but I would say small but mighty. We had a sample of about 250 people-ish. We conducted a home visit on everybody who was in that. One of the main things that we found that we've talked about is that they were providing just basic level services that didn't qualify as waiver services. So an attendant would come to the home that they could have gotten on the lower level plan, but they weren't getting anything on top of that. So we saw that in large numbers. The particularly egregious cases that we saw, we would generally have a call with the health plan and address those issues immediately. The nurses on the team were great at identifying that and being very aggressive about this person is in danger, this needs to be fixed immediately. When something was really bad in a home, we would make something called a referral. And that notified agency people who had teeth, who could kind of go after them and say, you haven't provided these things that have been identified to this person for this certain amount of time. And I expected them to say, because of that, here's the amount of money you owe for this person. Let's pay it up, pay stat. That did not happen. It became well, let's work with them, maybe they haven't been educated right, and at the end it took a very long time for those results to come through, and we reported them, and the leadership, I don't even know who, because at that point it was out of our hands, it went through them, and they decided that the fees were so high that it would have put the companies out of business, and then we wouldn't have been able to implement the waiver. And so because of that, they decided, and I don't know what criteria it was based on, to do a recoupment instead of having them pay the fines that are laid out in the contract very clearly. And one of the things that was so important was that they were not providing the level of services that were specified in the contract. And when you don't provide that, that's fraud. The reason that Superior was involved more than other companies is because they did the foster care program. And so a lot of those kids in the foster care are very sick. They would call them members, and that was not my favorite term, because the word patient denotes a certain amount of vulnerability that this person has that you are to take care of. Insurance companies don't take care of you. Doctors and nurses and attendants and your family members take care of you. Insurance companies make payments. So I feel like at the end of the day, the taxpayers of Texas are not getting their money's worth out of this. And I think that if they knew the amount of money that the insurance companies were making at the expense of the people who are in their homes, that they would be outraged and worried and appalled. You cannot take hours away from a quadriplegic and let them lay there and look at the ceiling for 14 hours. You just can't do that to another person.